Today with us we have someone who can answer the biggest question we have right now. What is COVID-19 and how do we protect ourselves? I would like to introduce Dr. John Ramapuram.
Thank you, sir. Thank you for being on call with us today. And it is actually a pleasure to have the in charge of doctors for the COVID-19 task force of Mangalore to talk to us right now, and that too you being in medical superintendent of KMC Attawar, and that too being a specialist in infectious diseases. I think you'd be the right person to answer a few questions. Actually, the reason why we came up with these questions also are because a lot of us, actually, a lot of the people that work in our company and also their parents and my parents, they had this question. And usually when we think about this, and the only way that we have answers for these questions is by looking at WhatsApp. Unfortunately,
okay.
Unfortunately,
very dangerous place for you to get an answer.
Yes, sir. But then the thing is, there is no other source for us to do that. And even when we get something from WHO and then something else goes, so just that we made a bunch of questions through just by talking to our parents and the people that we know regarding, what are your worries? So that we can ask the right person these questions so that we get the best advice possible. So that's why, sir, we have requested you, and so we are very thankful that you're here today. So we have heard a lot about COVID-19 and what it has been doing. And what I want to focus right now is on the people who are not actually at home, but people who are out there, right? People who are risking their lives, and people whose family members are doing this. So we just want to talk about doctors, people who are in essential services like doctors, delivery boys, grocery stores, police and stuff like that. Right? People who are in this professions, what they should be doing and what their family should be doing. Virus, something like this has been very common, but why is this a big deal? Why is COVID-19 a big deal? Why is it more dangerous than the others?
A very interesting question, because people say that this is a common virus that is seen, then why are you so bothered about it? It's a common virus, though it's a common virus. The percentage of people who get, if you look at it in any country that you take out, common cold is something which you see very commonly. It's not that difficult for you to see people who have coughs and cold around you. But this, what has happened, this is something which gets transmitted from person to person rather very fast. So if you are close enough to a person who has this, then chances of you acquiring this is very high. The mode of transmission is very high. How fast you acquire this disease also is very high. And then, unlike this common cold, the percentage of people who land up with morbidity and mortality is slightly higher. This, I would say, maybe 5 times more than a common cold. But this is not a very dangerous disease like people say. I would not say that. People need not be worried about it. This is, I told you, it's a disease like a common cold. Only problem is that morbidity and mortality is slightly on the higher side. For example, if I tell you, but common cold also is very commonly seen. This patient, in any society that you take, wherever it may be, the number of people who can become positive or who acquire this disease varies from 20 to 60% of the population. At one particular time. It's not that today you'll become positive or tomorrow you'll become. Maybe in the next 3 to 6 months, chances of a person acquiring this disease is very high, because the speed at which this gets transmitted from patient to that's the reason. So if you look at in India, the number of people who can acquire this disease is huge. When you talk about our percentage of patients who are positive. So dangerous thing is people who are elderly, I would say above the age of 65, and who have other comorbidities such as hypertension, diabetes, heart diseases, chronic respiratory disease. All those people, chances of them becoming a little bit serious is more. So out of this, I would say the mortality is comparatively higher. We go to somewhere around 3% is what they talk about mortality, but that is especially in elderly people. So be a little bit careful among elderly people. We should not be giving it to elderly people. That's something which you should be careful about. The speed at which it spreads is really fast. That's why it started somewhere in the end of December. By December, all across
the world. If by any chance, let's say I get it or somebody in my family gets it, so what am I supposed to do? Like, how am I supposed to, what steps am I supposed to take?
Even if you get it, I did not tell you more about it. Even if you get it, 80% of the person who acquires this disease will pass off as a mild cold or a mild throat irritation and then go. You will never even know that you had it.
Okay. So
80% of the people. 80% of the people. So you would have just thought a mild throat irritation and go away. That's all. 80%. Only 20% of the remaining 20% will have a little bit of symptom, or some of them might have slightly more. So usually you'll never even notice it. That's how it is. So it'll be passed through. Only thing is, elderly people, they can have worsening of the condition and then land up in difficulty.
Let's say tomorrow I get up with a cold, okay, or I have a sore throat, or I have a cough. Now, what am I supposed to do, sir? Because this question actually I have heard so many times, because I talk to people and they're like, I have a cold, I'm worried now. So what would you give? What would you tell them to do?
This is the most common thing that happens. People come to us from all over the place saying that I got cold, do I have COVID? No, it doesn't, because see, common flu, I told you, common flu is still around, so we do get this many times. But ICMR, this is a government organization which gives you directions as to how to make a diagnosis, on what basis you make a diagnosis. So guidelines have been put by ICMR. So when the ICMR is made guidelines, that keeps on changing as the time advances. Or today's guideline might not be tomorrow's guideline, because if we learn something. Because I'm sure you might have heard of stages of this disease, 1, 2, 3, 4. There are different stages in which that is happening. So ICMR at present, they have made a diagnosis. How to come to a diagnosis that any person who has had international travel and they come back within the last 14 days, that's 2 weeks, and who has any features of fever, sore throat, cough or breathlessness, only these are the people who are considered to be suspected. Okay. To have COVID.
Okay, so not other people.
No, not you who have not traveled anywhere. You've been very locally here. We will not even test you, because testing also is not allowed for those people whom we do not suspect to have according to the guidelines. But it can change over a period of time. These guidelines will change over a period of time when the local transmission takes place. Even though most of the patients whom we have had are definitely people who have come from abroad. Most of them have come from abroad, and their primary contacts who are very closely related to them. And those are the people who come as positive. It is not yet spread to the community per se. So guidelines is very clear as of today, saying that anybody who's come back from a foreign tour in the last 14 days and they've had sore throat, cough, breathlessness with fever, only they are considered to be. And then there are other conditions also that come if I'm in contact, if one person is in contact with a diagnosed COVID positive patient, they are also taken into consideration. And then who has got severe respiratory illness, that's also taken into consideration. But then guidelines are very clear, not anybody who has cough and cold. You don't suspect that.
So if I have cough and cold from tomorrow, so I just go back to sleep. So I don't have to I don't have to worry about anything.
So please don't worry about it. It's a common cold that you are having, or a mild pharyngeal infection that you are having. Don't worry about it at all. Only when this is there, you need to worry. Otherwise, you don't have to worry.
Like, at what stage do you think, like, if my cold becomes more severe, and if I have, let's say, wheezing because of that, like, at what stage should I think that, okay, fine, maybe I have some problem, or should I just ignore all of it and just, rest at home?
I told you, the most important criteria for you is if you have gone for a foreign tour and then you come back in the past 14 days. That's one of the biggest ones, main one. Second one was, if you have been in contact with any positive person who has been diagnosed to have COVID, and that is the second one. And then third one is, if you have severe problem of breathlessness and cough, and then when you come to the hospital, we suspect. These are the cases. So mild one, we will not even. So you cannot even be tested, because the government has very strict guidelines on whom testing can be done. Even if we send the sample, a throat swab or a nasal swab, if we send it for testing, they'll never do it. Or they'll reject it, saying that you don't fulfill the criteria for it.
Like example, my mother, she's an employee in the bank, right? And my father, he works in an insurance company. So both of these fall under essential services. So they go outside the house every day. They have their duties, so we can't ask them to stop. But now
Definitely.
if they are going, so what do you think that, what are the precautions they should be taking to make sure that they are not getting infected?
I said earlier itself, there are basic thing is social distancing. Second one is washing your hand, and third one is wearing a mask. These are the most important thing that you need to do wherever you are. But when you're supposed to do essential services, you have to go for the work that you're supposed to do. You should do the work that you're supposed to do, and there's a chance that you'll come in contact. Or the distance that you need to keep from anybody is the 3 meters.
3 meters.
Not 3 meters, 3 feet. That's 1 meter. 3 feet. Sorry, 3 feet. It's 1 meter. 1 meter. We say that one hand length. That's what you need to keep. Keep people away from you. That's the most important thing. If you do that, and then if you wash your hands regularly, and then if you wear a mask, these are the 3 things that should be done for you to protect yourself. There's absolutely chances will grossly come down there. But then when you're in the bank, you might have to count the notes that you're using. That's something which you're using. And when you're using the notes, one thing is either you wear a glove when you're using that, so that after you finish everything, you can remove the glove and wash your hands thoroughly. Or each time after you count the notes that you're supposed to do, you use either a hand rub thoroughly, properly, and then clean your hands properly. That should take care of it, and then keep the distance.
Okay, so I think the same advice goes to a vegetable vendor or someone who is in a shop, right? Who are dealing with a lot of customers.
Definitely, because people should not be allowed to crowd around you.
Okay.
And keep the distance from the person that was there. And if our people are crowding around you, make sure that they wear a mask and come near you. That's what should be done. So that I told you this. If you wear a mask, the virus will penetrate through the mask and enter you. Unless and until otherwise, you should wear something called as, I'm sure that you might have heard of something called as N95 mask, which should not be worn by common people, because these are things that are running very low, and the healthcare workers need this when they go near a patient and then do certain procedures in them. So as of now, the masks are not available. The N95 mask is not available at all. There's something called as the personal protective equipment that is required by the healthcare workers to look after people who are sick. That is not available because people are using it unnecessarily and wasting the resources that we have. So a person should be wearing an N95 mask only when they go to certain areas. All guidelines are given by ICMR, even in hospital, in which places that they need to wear a full personal protective equipment, that is a full gown, and then gloves and glasses and cap, and then N95 mask. All these things are very clearly laid down, so we know at what level it is to be used. But general people are not very aware of it, and then they wear this N95 mask and walk all around the place. And then the biggest problem, the saddest thing that I come across is that they say that healthcare workers do not have this, and they find it very difficult to take care of patients without these things. That is something which should never happen. Regular mask is all. Even if that is not available, the triple layer surgical mask is not available, they can make the local, whatever mask that is available. I told you, it is not to prevent the virus from entering you.
Correct. It's to make sure that it does not enter other people.
You don't give it to another person. That is the reason. So it gets stuck within even if you cough, it gets stuck within that mask, so that it doesn't come out. That's the basic idea why we should do that. So as long as you take care of these 3 things, that social distancing and hand wash, and then wear a mask, prevent it from getting transmitted, I think people are very safe.
Say in a vegetable market, or let's say in a grocery shop, the thing is we have so many people coming in contact with items, right? They will check some items and they will leave it over there. So in this case, like when we are going shopping, like what are we supposed to do? Let's say I buy the vegetables, and should I get them? Like what do I do?
No, you can see if they touch it, there is a high chance of this disease spreads through droplet infection, and then whenever there is a cough or a sneeze that takes place, these small particles goes and settles all over the place. And then if you touch that, and then accidentally you put that hand with which that you've touched without washing onto your face, and then it goes into your eyes, your nostrils, and the mouth. That is how you get this disease. So be very clear that whatever happens, your hand doesn't reach your face.
So that's
wherever you touched it, your hand should never reach your face. That's how it should be. Whatever you want to touch your face, wash your hands thoroughly, only then you touch your face. So even if the vegetables are there and if people have touched that, there is absolutely no problem. All you need to do is take it home, wash it thoroughly, and then cook it properly before you eat it. Don't eat that raw like that. So wash it thoroughly and then you can eat it. There's absolutely no problem. Even if you eat meat items or fish or egg or whatever it is, it's not. People are really scared that if I eat chicken, I'll get this. No, these are all wrong concepts that you are here. So even the vegetables, you can wash it thoroughly. Come back home and then wash your hands. Even if you have carried a bag in which that somebody has touched it, wash your hands after you come back home thoroughly and then go about with your business. Otherwise, there's a high chance of you acquiring this disease.
Okay, so basically because this is a myth but very recently the chicken prices dropped on by loads. There are people who were just growing chickens because but then there is no way that chicken or meat or fish or any other item can give you will make you fall sick. So consuming these items also is not a problem.
Absolutely no problem. I do not know from where the ideas come that people should not eat chicken. I think the only benefit that people have got is that the chicken prices crashed. So, but sad for the people who deal in it and they have been losing heavily on this. So, I would say there's nothing to worry about it as long as you clean the chicken and then you boil it, cook it properly. There's absolutely no way that this gets this. It's totally wrong. Any food you can eat, provided it's cooked well, you can eat. Absolutely no problem.
Cooked and washed well. So that is a mantra that we have to go.
Yes.
So yes. I think with this virus, we are all going back to the basics. Things that we should have been doing all along. We are learning now in a very different way.
We say namaste.
Yes.
Instead of shaking hands, that's what we do now. We are going back in time.
So now that my parents go out, and they perform their duties and they come back home. So I have very old grandparents in my house. So my grandmother and my grandfather are at home. So what would you say would be the best way for my parents to behave, or what are the actions that they need to take once they get back into the house or before they get into the house, so that if in case there is any chance of transmitting to my grandparents or me or whoever it is are reduced?
This is a very important question, Didi. Everyone should know about it because I told you earlier, it's anybody who is above the age of 65 and who's got other diseases, we call it as comorbidities, that is whether it's the hypertension, BP which is high, or diabetes, or they have any heart disease, the chance of them acquiring this disease is very high, and when they acquire the disease, the chance of them landing up with complications also is very high. So we need to be very careful that we don't give it to our grandparents. That is our duty.
Exactly.
So please don't come back and hug your grandparents. No, never do that. So although you would want to, you need to keep that social distancing from them also. Again, I'm coming back to the same thing. But as soon as you come back, the first thing what you need to do is that go to your room, take a good thorough shower. That's the most important thing when you go out and come back. And if it is possible to keep them isolated in a room, that is the best place that can be done. Or you get yourself isolated in a room, either whichever way, so that you isolate, you don't mix too much with the grandparents. That's how it should be there. That for some time it is worthwhile. The trouble that you take will do you good because the grandparents will have a normal life for a longer period of time. Otherwise, you will be giving this disease to them. As soon as you come back, wash your hands thoroughly first and then go and take a shower. And then your clothes, you keep it separately for washing it. All you need to do is put it in hot water and then keep it there for 15 minutes and in the hot water, and then it can be sent for washing. Absolutely, there won't be any problem. The chances of you transmitting this disease to your grandparents come down very much if that happens.
Now that we are all at home and we're not meeting people, but we are stepping out to buy essential services. So the only thing I think we need to do is make sure we wear a mask, wash our hands, and social distancing. So this is
wearing the mask is not for you.
Exactly, it's for others.
It's for others. Yes. If you do this, if everyone keeps on doing this, I would say the transmission rate will come down drastically. That's what we believe in.
Okay, so even when you're going to an ATM, ATM and using the machine, counting the money, so do you think there is any chances with that? Any chances of? Okay.
Definitely. When you are using the ATMs, you can get the disease through the ATMs. Even biometrics in some of the places that we have. Even in our hospital, we have the biometrics, but we have ordered them not to use the biometrics anymore.
Okay.
These are all small measures that we need to take so that the spread of the disease can be brought down. Biometrics has to be stopped, and then touching unwanted things, unwanted papers, you should not touch it, because I'm sure that you will come across a lot of things that you want to do or you don't want to do. Somebody gives you a paper, you might have read that. But what I would like to say is, keep your hands away from your face.
Okay. So that is the key.
It doesn't come close to your face. If ever you want anything, after you touch anything, if it is possible, wash your hands or use the hand sanitizer that is available. And keep your hands strictly away from your face.
So let's say I have a business, right? I have a grocery store or I have a manufacturing facility. So what are the measures that I need to take before I let people inside to make sure that nobody else who is working with me get, who they are working with are going to get the disease from them in case they are, infected? So is there any measures that a business can take to make sure that their people do not give the infection between each other? Because we have to work in close contact at some point.
Definitely. What you are saying is very true as long as the business practice is going on. But what I would like to say is that anybody who's entering your business organization, and if you have sufficient number of people who are working there, I told you, give them a mask.
Okay.
So that even if they cough, they don't spread it to anybody. That's the first thing. That's what we are doing in our hospital, saying that anybody, irrespective whether the patient has got cough or the patient does not have cough, as soon as they come in, we say that use a mask. Okay. Even the simplest of masks, that is enough for you to wear, and so that you will never transmit the disease. It's not that you will never transmit, the chances of you transmitting the disease comes down drastically. And then please don't go and shake your hands with them. Nobody should. Don't go very close to that person. Keep the distance. Oh, the mantra for this is social distancing.
Yes,
that's one. And then wash your hands. These are the two things. And then put a mask on so that you protect others.
Do I need to take any special measures? Because I don't want to take the risk of my employees or people that are working with me from infecting it to, I don't want to take any chances. So should I take any measures of, making sure that every day I check the temperature or something like that to make sure
temperature. See, I told you temperature. If a person has fever and if he is working in your organization, definitely ask them they're febrile not to come to the hospital.
Okay.
And if they have cough or throat pain or sneezing, they should not come to your organization. No,
okay.
You should avoid them tell them that till they're better, they should be staying at home and come. Because if they have any of these things, they should never be coming to the institution where you're working.
So every morning, I think, would it be a best practice to ask everybody if they're feeling okay or if they have any certain symptoms like this? Would that make sense?
I wouldn't say that you should keep on asking everyone. You have 100 people, you need to ask everyone. But make sure that you tell them if you're having any problem like this, please don't come.
Okay.
And if you notice somebody has got anything, you ask them to go back to. These are the two things that you should do. Because you should not allow anybody who has symptoms and signs of this to be working in your organization. Because it's very unlikely for them to have this disease. But even if they have it, it's our duty so that it doesn't spread among your people who are working.
We have a small section called as myth busting, because we have a lot of WhatsApp messages which keep coming around, and these things, instead of giving confidence, they inflict fear. So
definitely that's what happened. Yes.
So I think in the last few days, a lot of houses in Bangalore and I think all around the world have seen a lot of home remedies come out. We have having garlic water, having tea, having lime tea, and there are like n number of other home remedies which are coming all out right now all together. So is there any truth to it? Can we do it, or do you think it should not be done?
Because these are not proven things. These are all grandmother's treatment that we call it as, and I don't say it doesn't have anything to that. Maybe it has got its own reasons from the age-old thing, customs that they're talking about. Some of them will have antibiotic effect to that. Some of them will have an antiviral effect to that. Some of them will have an antioxidant effect to that. So it depends on what you're having. Some of them will improve your immunity a little bit. So it's not that it doesn't have any effect to that, but it's not a proven thing. It's all, what should I say, grandmother's remedy, that there is no harm in trying it if you want to, but there is no proof that is going to be of any use either.
Yeah, and I think what's more important is not overdoing it, because I think if somebody overdoes it, then they will fall into another complication instead of this one.
That's the only thing that people will land up with, because these are things that should be, I told you, this doesn't have any proof, and people say that it works, but nobody knows whether it works or not, but no theoretical, no science behind this, so it might not be of any use. But some of them are very possessive about this. That's something
Correct.
which you should not be doing. That little about anything is good, but too much of anything is pretty bad.
Okay, so even if you're trying it, let's keep it under control is what the advice would be. Actually, this is something that I've heard quite recently from one of the people that work with us, that one of their family members was sick, and it was nothing to do with cold or fever, but they were sick, and they were worried that if we take them to the hospital, they will quarantine even them for 14 days and all of these things. Like, people are genuinely scared about coming to hospitals now. So what is your advice on that, sir?
I told you it spreads through droplet infection. That's the only way that it spreads. If you go closer to the person, you stay 3 feet away or 1 meter away from that person, chances of you acquiring the disease is almost negligible.
Okay.
And then you say that you come to the hospital and you'll acquire the disease. This is wrong, because people can have this. That's why I said anybody who comes to the hospital, we ask them to wear a mask and come outside. As soon as they get into the hospital, the first thing we do in the entrance, there'll be security guard will be standing there, who will put some hand sanitizer in your hand. And there's something called as a triaging. As soon as you reach the hospital, before you step into the hospital, there'll be people who will ask you, first you're supposed to go to that counter, they'll ask you, have you been to any international tours anytime recently? Or you're having cough, breathlessness or fever anytime recently. If you have any of these things, you will be directed through a shorter path to another place where you will be screened for this. Otherwise, you'll be sent to the regular OPD. You will never reach the regular OPD if you are going through any of these things. If you have any of these things, you'll be taken to that and you'll be treated as a suspect, and the doctor will see you carefully. And if you fall into that criteria, you'll be evaluated for that. If you don't fall into the criteria, you'll be again sent back to the regular OPD. So this disease you'll not acquire it if you go to the hospital, but unnecessarily people should not be visiting the hospital too. I got for routine things people should not be going to a hospital. No.
Right now.
Checking the blood pressure, checking the blood sugar for a routine. The doctors ask me to come every month, so I'm coming. No, unless and until the patient requires hospital help, only then they should be visiting the hospital. They should not be visiting the hospital at all. Because I told you the mantra again is social distancing that you're supposed to do. Keep away from people as much as possible. That's what it is. And if one person is positive, we try to minimize the number of people, healthcare workers he comes in contact with, so that the disease spread comes down. That's the basic idea. Keep away from people. It is advisable only if significant illness is there, only then go and visit a doctor or go to a hospital. And nowadays you can see that most of the hospitals have come out with teleconferencing facilities. Most of the hospitals have come out with their own. That also can be used. Over the telephone. Over the telephone you can contact the doctor and get whatever benefit that is there. If it is minor illness, that's also is a possibility. We also are thinking in terms of newer ways of managing the patients in the ICU instead of going and seeing the patient very closely, or we keep monitoring patient from a distance with the devices that technology that is available, so that we don't have to go close to the patient unless and until it is required. But if you don't have real good reason to go to a hospital, don't go.
Can you just tell us, because this is quite disturbing to know that doctors and healthcare workers who are actually putting their life on the line, they know the risk, but still they're fulfilling their duties to save everybody else. Now these people are not being let into their homes. Now, just to, if anybody else also has this idea, okay, I have a doctor in my house, I need to stay away from them. Can you tell us what precautions doctors take to make sure that they don't spread it to their families? so that people know that okay, if they're coming home, we are safe. They are going to be okay.
See, some of the patients, because we look after this COVID positive, we do have patients who are positive in the hospital. We are the people who look after them. I told you, we wear the personal protective equipment that's called as PPE that is required to look after them. If you wear them properly and then you look after them, chances of you acquiring the disease is very low, very low. So what we have our guidelines put in very clearly saying that when we go and see the patients, we don't even wear our regular clothes and go inside there. No, we wear the OT scrubs. I'm sure you know what is the OT dress, operation theatre dress that we go to the hospital, we change it into the OT scrubs, and then when we go there and see the patient, before we see the patient, we put on the full personal protective equipment that is required. There's many things that you need to wear for you to be protecting yourself. Only after that we go and see the patients. That's how we see the patients who are positive. So we wear all these things, and including that N95 mask that we need to wear, so that the infection is contained very well. And the moment there is a way in which to wear it, this personal protective equipment, and very right way in which to remove this also. It's not just remove the shirt as how you feel like, and just be disposed of in the proper way that it is to be done. As after you do that, then we even make sure that the healthcare workers take a shower before they go home. And if they don't want to go home, they have these elderly people at home. We also tell them there is place for them to stay, so that they're providing, and even the government does, because we work very closely with the district authorities, the DCs, and all those people who are there. So our plan is very clear as to what and how our Dakshina Kannada district should be working and where we are going to reach. That's why you would have heard that Venlock is being converted into a COVID hospital totally. Now only COVID patients will be looked after. Maybe because it's just being converted, it takes a couple of days time for us to get everything in order. Maybe it will be ready within a couple of days time, so that we will be totally geared to look after all these patients. So we tell the healthcare workers, if you're worried about going back home, if you have elderly parents, or if you have young children at home and you would like to stay, we will provide you with the place. Even the government is very clear about that. They have made sure the places are available, good accommodation is provided, good food is provided for them, so that they can stay there and then they will not infect the people. Even if they go home, the chances of a person, after all these measures that is taken, is very negligible that they will be transmitting the disease to anyone. So if they want to go and...
We just need to tell everyone that if the doctor comes to your house or somebody around you is a doctor, so thank them and don't scare them away.
I would say if you don't do that, you will be doing great injustice to them. That's what I say.
If you're working in an environment that is air conditioned, there are more chances of the virus breeding in such environments or surviving for longer and stuff like that. Or is there any facts to that, sir?
See, definitely in any virus, because we've been looking after the HIV positive patients, we've been looking after the H1N1 when it came and still managing that. Now this is happening, or we see the pattern that is happening over the years that is happening. So HIV is a different kind of disease that gets transmitted through different roads, but H1N1 is almost the same way that it gets. That's the swine flu. I'm sure that you know about that swine flu. We see that during the cooler temperature months, it surges. And then the warm temperature comes, the summer comes, the intensity comes up. So in a way, we were happy that it did not happen 3 months earlier in India. But now we are almost in the peak of summer, so the chances, I personally believe that chances of this disease getting so exponentially high will come down because of our temperature in our part of the country. Most of the other places, it is around 0, China and all there. If you look at that, the center where it has happened, it's almost in the same place where the temperature is around 0. That's what it is.
Okay.
Where the maximum people who have had this disease, whereas ours is around 35, 36, where the virus do not survive for a long time. But if a person who is there in the AC, air conditioned area, the biggest problem is the air exchange does not happen in the air condition. If you see that AC, it is the same air that keeps on circulating. It's cool air that keeps on coming. So one person in that place has this infection, it keeps on circulating, so the others also can get infected. And the temperature is maintained at the pleasant temperature for the virus too, so the virus does not die so fast. So maybe there's a chance if you sit in the AC with others who got this, chances are there that the virus survives longer in that climatic condition, so the chances are there it can spread more. But that all depends on the number of people who are there in the room.
Okay.
Now it definitely is responsible to the number of people there. If it's a crowded room, definitely I would say don't switch on the AC. I would say open the window. But if the number is very minimum, you can switch on the AC. Still, it might not make that much of a difference.
We have a lot of people who stay in rooms and stuff like that where they don't have their own kitchen. So they will be ordering food from outside. So if I'm ordering food from outside, what are the different precautions I should be taking when the food is coming to make sure that, because that person also will be handling a lot of other containers, the delivery boy. So what should be the precautions that I am taking?
The same thing I told you, that if they bring it in a package, make sure that your packet, the cover with which that they come is removed as soon as you get it, and then thrown into the waste paper basket, and then wash the container and wash your hands very thoroughly before you put it in your plate, and then if it is possible, reheat it and then do it. If it is possible, you will. But if it is a cooked food and it is kept cleanly, I don't think there's any problem in that. But if it is possible for you to reheat it, I would say reheat it and eat it. That will be the best thing. You open that, put it in your plate, reheat it and eat it. That will be the best way that you will be able to prevent anything from that. Nothing will touch you.
Thank you so much, sir. Thank you so much for spending so much of your time with us. Like it was
pleasure.
It was actually very comforting for me, and I'm sure for most of the people that will be watching this video to know that the source of this information is the one who is heading all the doctors in Dakshina Kannada to combat the COVID menace that we have, that pandemic that we have. So I'm sure a lot of people will be able to take a sigh of relief after they watch this video. So thank you for taking your time.
Can I add two things to this? Because
yes,
like
please.
To give some advice to the people who are listening to this, saying that I would like to say, don't be worried. This is not a very, very dangerous thing. Don't be worried about it all. It's not a very dangerous disease that will destroy you. No, even if you have it, don't worry. I said 80% of people will not even know that you have it.
Okay.
That's the first thing. And then please don't crowd. When this lockdown is something which is very important, that I would like to tell you about this lockdown which has happened. People might start complaining about this, that you don't get it, because lockdown is, I would like to saying that any such epidemic that is happening, it's got a peaking that takes place. It goes up and then comes down over a period of time. Because the peaking becomes early, what is going to happen is that the number of people who get this disease becomes very high, and the resources you don't have. You don't have the beds, you don't have the ventilators, you don't have the doctors that you are taking care of it. Or then there's something called as flattening the curve. You bring down the peak. You stretch it. That's what you need to do. When you stretch it, what happens is it might go on for a couple of months. The number of people if getting affected will be the same. It might not change, but the peaking will not happen. So you'll be always within the resource that you have, so that we can manage the patients well. Otherwise, when you have a peaking that happens very fast, when it goes beyond the resources that you have, beyond the beds that you have, beyond the ventilators, beyond the doctors, so then it becomes very difficult. So that is the reason if you have a lockdown, what happens is this social distancing happens very much. Social distance, so that the transmission from one person to the other person does not take place that rapidly. When that happens, this disease spreads over a longer period of time. When that longer period of time is there, when the government has got the resources, the private people have got the resources, and people might not land in bigger trouble. So don't get worried. This is not a very, very dangerous disease. That's something which I would like to say.
So like every month, every year, how we have flu season. So you're saying this time also this COVID season is going to pass and everyone is going to be fine at the end of it.
I'm sure. God is with us, so I don't think there's anything to worry.
Yes, sir. Thank you so much, sir, for your time. Is there anything else you would want our viewers to know, sir?
No, I think you are doing a great job at doing what you're supposed to do. Please pass on the information, because knowledge is what makes a person a better person. And if you can pass on information to other people, the right, good information and not
Correct.
the wrong information, I think it will make a whole lot of difference to the society and the people.
Thank you, sir, for taking out the time to talk to us. And we are incredibly grateful for the work that you are doing in keeping our city and the town safe. We wish you all the best. And
Thank you very much for it.
I hope my conversation with Dr. John Ramapuram has cleared most of your doubts. If you have any concerns, please drop us a DM, comment, email, anything, and we will find the right person to answer them for you. Please follow us on Facebook, Instagram, and subscribe our channel on YouTube. Thank you.